my YouTube channel, for Education. It's been a while, but I'm not. Now, we're going to discuss about the important advanced questions and answers. Okay? Actually, it's a combination of all categories like ICD, CPT, etc. And also some modifiers are there. So let's get started. Here is our first question. If diagnosis includes a bilateral condition at let's move forward for bilateral. So what should you do? Here is the question here. And also some options are there. Option A, report two separate codes for the left and right. Option B, report only one side. Option C, use unspecified code. And option D, code as bilateral, even if not listed. So in this case, the right answer is option A. Okay, that is the explanation. If the bilateral code doesn't exist, report separate code for left and right. Okay, and CD guidelines. Okay, so our right answer will be option A. Next is it's a modifier related question. The modifier 51 is used for what purpose? Okay, what is the usage of modifier 51? Okay, so now multiple procedures are performed. Which modifier is used to indicate a secondary procedure? Okay, so the right answer is modifier 52. Okay, here is the answer. Option B is the right answer. Okay, you can check this code or this modifier it in your CPT textbook. Okay, so it's used for indicate multiple procedure. And the third one, in and okay, new versus established patient. A related question. Patient who has not received services from a provider who provide greater than 3 years is considered. So, what will be the correct answer? Option A is established, option B is initial, option C is new, and option D is transfer. So, the right answer is option C, new. Okay. According to CPD Trial, the new patient is one who has not received services in the past 3 years from the same provider or group. Okay, so this is the explanation of the abilities. Next is fourth one is ICD-10 related acute versus chronic. Okay, what is acute condition and chronic condition? Acute means it's short time disease or short time condition. Okay, and chronic it means it lasts for long term. Okay, so this is the basic difference between acute and chronic. So let's start with one question. Okay, here is the question. Condition is documented as acute and chronic. What separate forms exist for each? Correct form. So here are the options. Look at the chronic condition. Option B, acute for only. Since report both with acute code listed first. Option D, use unspecified code. So what's the right answer? When two conditions, acute and chronic, are documented together, you have to quote both. Okay, report both codes. If it's acute code is the first. So what will be the first code will be acute. So you have to report the code both. Okay? The first code will be active and after you have to code wrong condition too. So our right answer is option C for both with active code listed first. Okay. And fifth one, it's also a modifier 25. It is appended to. Okay, what is the condition? Option A, a surgical code to indicate a return to OR. And E and M code to indicate a separate significant sounds. A lab code to indicate distinct spacing. And final option, option D, a preventive visit for a new patient. So the right answer will be an ENM code to indicate a separate significant service. This is option procedures of modified 24. Okay. So modified 25 and modified 51 is very important. So try understand the basic concept related to modifiers. Okay. Next is question 6, number 6. According to ICD-10, okay, it's related principal diagnosis in inpatient setting. So here is the question. What is the principal diagnosis in inpatient calling? Okay, principal diagnosis. The reason the patient chose to come. Option B, the most chronic condition. Option C, the condition chiefly responsible for admission. And option D, the diagnosis was covered. So the right answer will be the condition chiefly responsible for admission. Okay. Admitted person or admission responsible for admission is the right answer. Answer C. Okay. Because once diagnosis is made, it the main reason for hospital administration. Admission. Okay. Main reason for the hospital admission, but admission is reason. Seventh one, when no CPT code exists for a procedure, what should you a deleted code or a HCPCS code, an unlisted procedure code, or modified procedure. So which is the appropriate code where not, a CPT code exists for a procedure. How to handle this? The right answer is option C. Okay, an unlisted procedure code because when no CPT code exists, into recommendation for review. In this particular case, you have to code as an unlisted procedure code. 8.1 HCPCS or HICCUPS, the use of modifier GA. GA is used for when the services experiment. Option B, APN is signed and on file. Option C, the provider wants payment for patient only. Option D, no medical necessity exists. So the right answer is option D, APN is signed and on file. Okay. It's an important one. Just go through this. I think ABN, full form of ABN is Advanced Beneficiary Notice or ABN. Okay, it's fine for Medicare procedure. Ninth one, ICD 10 related. Okay, that guideline is used for what cases? Okay, in ICD 10 when it is an intended guideline, what does it include? Option A, optional association. Option B, product separately. Option C, automatically linked unless documented otherwise. Option D must be tracked by the provider. So the right answer is related to with guidelines. It's automatically linked unless documented otherwise. Option C is the right answer. Okay. Condition listed with are presumed linked. Okay, linked. This is option C. Unless the provider clearly documents otherwise. Next is 10th one. 10th one is related to global surgical package. This is immediate related question. Which of the following is included in the global surgical package? Post-op unrelated EATA, return to OR for complication. Option C, routine follow-up care, and option D, surgery for different organ system. So the right answer will be option C. Okay, explanation means some routine post-op care is included in the global surgical package for CMS and CPT coverage. So this is the most important 10 related question. Okay, so everyone, go check it out and see you in the next video. Bye bye.